Now, over 100 casual workers of the Tamale Central Hospital in the northern region who were sacked about 3 days ago are demanding the removal of the medical superintendent and administrator of the hospital, who they accuse of collapsing the facility. The group alleged that they were sacked because they had met to deliberate on how the hospital was collapsing.
Addressing the media at the Tamale Central Hospital, where they presented a petition on their grievance, leader of the group, Hussein Mohammed Mutala, said services at the hospital has deteriorated to the extent that nurses have no gloves to wear, leading to the reduction of clientele.
Since this management took over, the medical superintendent and the administrator, we've not seen any kind of improvement or whatsoever in the hospital with regards to infrastructure, with regards to taking care, well care of the staff. And currently, the hospital is going through crisis. If you look at all the wards, there are no clients in the ward. No one is there. Why? Because the management, they are not taking appropriate decisions to allow the clients to come to the hospital. So for this reason, the clients are also going back. Like, there are no medical supplies in the hospital. Yes. Nurses have refused to work. Nurses are not working because the hospital have refused to provide them with PPEs. So when we approach them, they say there's no money. But we realize that insurance have been paid.
Now, Martina has been speaking with the hospital authorities on the demands of the sacked workers and joins us with more. Martina, what have the hospital authorities been saying?
We spoke to the hospital, the medical superintendent of the hospital, Mahama Mbehura, and he has denied all the allegations. He said that they used to have about 300 patients at the OPD, but currently they are getting about just 20 people, and that is because of the COVID-19 pandemic. People are not turning out for hospital service, and that means that they would have to downsize to ensure that they are able to cope up. He says that if it was outright sacked, they would have sacked the entire staff, but they have had to reduce the numbers. Citing an example of the records, he says they have up to 8 people, but currently they have just about 2 people. It doesn't make sense to keep all the 8 people when at a point you have just 3 people who need their records checked. Those are some of the things he mentioned.
Now, Martina, did he explain if these persons will have the opportunity to reapply to the hospital, or they would even have to continue their employment after the COVID-19 crisis is over?
He says that it is because of the COVID-19, and so they have the opportunity. All he said was that it is because of this pandemic, and so when it's over, there are possible means that they could get back. So all they needed to do was just be patient with the hospital while they ensure that they bring out things that would help the hospital run until the pandemic is over.
So who are those who started the narrative, Martina, that these 100 people were let go because they were collapsing the hospital?
It is not they who are collapsing the hospital, but they are alleging that they met because since the new management took over, the hospital has been collapsing. They are not putting in appropriate strategies to run the hospital, to improve the services, to improve infrastructure and the welfare of the staff. All they have done is mismanage the hospital, and so it has gotten to a stage where people are not patronizing the services because the services are poor.
Thank you very much, Martina Bugri, for joining us with that update.